One of the newest one was FDA approved in November of 2014 in the US, a medication called Lemtrada. It's a monoclonal antibody that targets a very specific antigen called the CD52. The unique thing about Lemtrada is just how it's sustained over time in terms of its efficacy. So Lemtrada targets the CD52 antigens, which are populated very heavily on B cells and T cells. So it basically depletes the B cells for about 6 months, and then they come back and they repopulate. The T cells basically gets depleted for almost 12 to even 18 months. They eventually repopulate and then come back to baseline. So the medication is given intravenously, so it's basically 12 milligram IV, given over 4 hours with a monitoring of 2 hours afterwards, given every day for 5 days, Monday through Friday, for example, the first year. And then in the second year, you get your second annual course, same thing, 12 milligram IV given once a day, but only for 3 days. It's actually a 2 annual course, and then after that, it really depends on your clinical activity. In the clinical trial, some patients have remained symptom-free for even over 10 years. In fact, 70% did not require a third course. About 20% have required the third course, and about less than 5% have required the fourth course. There's a potential that you could be done for a while. That's the sustainability of this drug, which is so unique compared to all the other MS therapies that we've had to date. Yeah, so MS is a lifelong disease, so I look at it as a lifelong treatment for my patient as well as a lifelong relationship with my patient. So we now have the ability to control the disease so that the patients can hopefully lead a pretty good quality of life. We're not curing the disease, obviously. We cannot reverse some of the damage that's already been done, but we're hoping to slow that process down for the patient so that the quality of life will hopefully be enhanced. Yeah, so there's some important safety information. You can kind of group them. There is the autoimmune disorders that can derive from this drug several years later. There are thyroid disorders, there are possible infection, and then possible malignancies. You have to kind of warn the patient that they may get infusion-associated reaction, and they can range anywhere from having a little feverish feeling, flushing, nausea, itchiness, pruritus, hives. But that's why we pre-medicate the patient. We give them 1 gram of IV corticosteroid for the first 3 days with each infusion, and so that will help mitigate some of those side effects. We also pre-medicate them with antihistamine or antipyretics, which really help. So Lemtrada is only available in a very restrictive distribution program called the Lemtrada REMS program, which stands for Risk Evaluation Mitigation Strategy. So every patient, every healthcare providers, every facility, every pharmacy that receives it, prescribe it, dispense it, and infuse it have to be certified under this REMS program. So patient get periodic laboratory monitoring, CBC, creatinine, urinalysis monthly for about a month, all the way out to 4 years after the last dose. And then they get thyroid function tests given quarterly, again, after 4 years after the last dose. It's definitely an addition, another armamentary to the war or battle for MS patients, if you will. And so anytime we have more treatment option for our MS patient, it's a win-win situation. The FDA label in the US states that Lemtrada, because of its safety profile, should generally be reserved for patients who have failed 2 other MS therapies. So these are patients that tend to be very highly active, relapsing MS patients. So they've had relapse even on their current therapies. They have MRI activity breakthrough even on their current therapy. They have disability progression even on their current therapy. They're a great candidate for Lemtrada. So it slowed down the potential for disability accumulation over time. It doesn't completely stop the disease. It's obviously not a cure for the disease, but it definitely decreased the frequency of relapses, slow down disability progression, and also affect MRI activity.